The following program is sponsored by Carolina West Clinic.
Hi, I'm Queen Johnson, and you're watching Spotlight. Our guest today is Dr. W.C. Verch of Carolina West Clinic. Our topic is neuropathy. Dr. Verch, it's good to see you.
Thanks for having me again.
Yes. I wanted to ask you, how does someone know if they have neuropathy? Is there a test available?
Yeah, so I mean, traditionally speaking, you would go to your doctor and say, I have neuropathy. He's going to refer you to a neurologist who will do the nerve conduction velocity and needle EMG studies is typically what would happen. I did receive my certification in NCV EMG electrodiagnosis, but I didn't really have any friends left after I kept sticking them in the legs with needles. No one comes out of that saying, oh, that was fun.
Right.
So what we did is we adopted the Toronto clinical protocol for assessing sensory deficit, basically. What that does is it helps us determine whether or not someone's a candidate for what we do, as well as manage certain expectations. This is what we think we can or cannot do for you.
Okay. And is there a genetic link to this?
So that's a complicated question. You know, in terms of, is neuropathy caused by a genetic problem? Infrequently. What I would say is in the case of certain predisposing factors like say diabetes, which accounts for a lot of it, your genetics may load the gun for you, but it's our habits and our environment that pull the trigger. For example, one is not diabetic simply because their parents were diabetic, a lot like heart disease. One is very rarely has heart disease because of their parents having heart disease. Typically it's we grew up eating the things that our parents ate, doing the things that our parents did. So we have to be really careful how much of it we blame on genetics, but it could potentially be an issue.
Okay. And it seems like you have a passion for this. What drove you to this profession?
It's really out of a sense of need, honestly. So many of my patients were talking about it, so I did a ton of research on what is helping people, you know, what's working, and that is an evolving process, but we're getting better and better and better at it. We hit our goals about 94% of the time, 95% of the time, so if I tell you, this is what I think we can accomplish, I can say that with relative certainty. It is a little bit complicated, but as this continues to become more successful, we're helping more and more people.
That's awesome. So for the individuals who are watching, let's say they have a parent or a friend, and they're noticing they're not quite the same, they're not quite as stable, how would they approach that individual to find out if they need to take the next step to find help? That's
a good question. So some of the things that we look for is let's say we're talking about dad. Is dad really uncomfortable with his feet? Does he talk about his feet hurting all the time, either all day or at the end of the day? Is there numbness or tingling present? Also, you can see subtle changes in their gait. Do they seem unstable? Does he talk about falling? These are all the things that are kind of red flags for us that someone's going to deserve some attention.
I understand you've written a book. How can
yeah,
viewers
absolutely. Yeah, if you just stop by the office, I'll give you a copy. I'm not selling these things. Give us a call. If you whether you make an appointment or not, we'll still give you a copy of the book, which talks a little bit about how to prevent neuropathy from getting worse. But if we get an appointment with you, we'll assess the situation. We'll figure out if you're in the right place or not, and see what we can or can't do for you.
Awesome. Thank you, Dr. Verch.
Absolutely.
Folks, as always, thank you so much for watching. We'll see you again soon on another edition of Spotlight.
The preceding program was sponsored by Carolina West Clinic.